Vitamin D is a fat-soluble vitamin that plays a crucial role in maintaining overall health and well-being. It is known as the sunshine vitamin because it is produced in the skin when it is exposed to sunlight. However, despite its importance, many people around the world suffer from vitamin D deficiency.
What is vitamin D deficiency? Vitamin D deficiency occurs when the body does not have enough vitamin D to function properly. This can happen for a variety of reasons, including lack of exposure to sunlight, dietary deficiencies, and medical conditions that interfere with the absorption of vitamin D.
Symptoms of vitamin D deficiency. The symptoms of vitamin D deficiency can be subtle and may not be noticeable at first. However, over time, a lack of vitamin D can lead to a range of health problems. Some of the most common symptoms of vitamin D deficiency include 1. Fatigue and tiredness. 2. Muscle weakness. 3. Bone pain or achiness. 4. Getting sick more easily or increased susceptibility to infections and illnesses. 5. Impaired wound healing. 6. Depression or feelings of sadness. 7. Not sleeping well.
Who is at risk for vitamin D deficiency? Vitamin D deficiency can occur in anyone, but there are certain groups of people who are at higher risk. These include people who spend little time outdoors or who live in regions with limited sunlight, older adults whose skin may not produce vitamin D as efficiently as younger people, people with darker skin tones who need more sun exposure to produce the same amount of vitamin D as lighter-skinned individuals, individuals with certain medical conditions such as Crohn's disease or celiac disease that affect the absorption of vitamin D, people who follow a vegan or vegetarian diet, as vitamin D is primarily found in animal products.
Do not forget to subscribe Nature and Pharma for more medical-related information.